Good morning, everyone. It's my pleasure to be here again, to be part of this great symposium, and to meet my friends and my fellow from Rwanda. So my name is Shirambere Cyprian. I'm from Rwanda, and I work for Partners in Health, which is a Harvard-based non-governmental organization, which is the main partner for cancer in Rwanda. So my presentation will give you an overview of our cancer center services, and then I will give you some information about implementation processes and early clinical outcomes of the patient who were referred to Nairobi Hospital for radiotherapy. So Rwanda, as many other African countries, after a few decades of intense work in infectious diseases, we decided also to prioritize the non-communicable diseases and include them in a national control plan. And in 2012, the Butaro Cancer Center of Excellence was inaugurated as the first national cancer referral facility in rural Rwanda. As you can see, it's a nice facility, which is in the northern part of Rwanda. Those of you who don't know where Rwanda is, it is just a neighbor of Tanzania and Uganda and Kenya. So our cancer center is just in the north. It is a 2 hours drive from the capital city. We have over 50 beds, 8 doctors, 36 dedicated nurses, an infusion center, and we can give up to 84 chemo infusions in a week. What are our services? So through the collaboration with our partners, the Dana-Farber Cancer Institute, the Brigham and Women's Hospital, we were able to establish a cancer program, and now we have a full functional pathology lab with automated machine, which we recently received from the American Society of Clinical Pathologists. We have a capacity of doing immunohistochemistry for most of the diseases. And these services are provided free of services, because in our hospital, they are not yet integrated in the national insurance. Chemotherapy is also provided free of charge, thanks to Partners in Health and our partners. We have a general surgeon who performs most of the surgery, but for the surgeries which are specialized, like for children, we send them to Kigali, because we have a number of surgeons in our referral centers. We don't have yet a radiotherapy unit, and to fill this gap, Partners in Health has some funds to refer limited patient to Nairobi, and we will discuss the process and the outcome. To maximize the chances of patients' retention and whatever, we provide transport fees, free meals to all our patients, and we even offer some food packages to take home to increase their energy intake. We have a nice electronic medical record system, which help to keep good track of our records for patient care and research. How do we provide cancer care in a country where there are very few oncologists, very few pathologists? So we had to design a model where the cancer care is provided by general physicians like me. I'm just a pediatrician with interest in oncology, and I received basic training from our colleagues from the Dana-Farber. And then we have national endorsed protocol for each disease we treat. And we have weekly conference calls with our advisors, and then we can exchange emails every day as it is needed. Our patients, as you can see, every year we enroll around 1,200 patients, and up to now we are counting almost 7,000 patients, and 10% of them are children. The majority of our adult patients are breast and cervical cancer patients. I think here, even though they are the most common, but there is a selection bias because we end up seeing patients for whom we can do something. So we never see a brain tumor because we don't treat them. In pediatrics, it's mainly nephroblastoma and acute lymphoblastic leukemia. Our patients, most of our 90% of our patients come from Rwanda, from all the provinces, but we also have patients from Congo, patients from Burundi, a few patients from Tanzania, and a few patients from Uganda. Some updates for in-country radiotherapy services. A radiotherapy unit with the 2 RINAC machines from Electa. They are being installed, and as I talk right now, yesterday I talked to our radiation oncologist, and he was telling me that in August, September, they will receive a first patient. So the oncology family in Rwanda is very excited to see, is looking forward to see this center opening. So in order to maximize its efficiency, the government decided to partner with a private service provider who will fill the gap of expertise that the country doesn't have, while we are waiting for our colleagues who are in training from different places to come. I have a few pictures here. I'm not a radiation oncologist, but these are the facility is being finished, and the 2 machines and planning city, everything is there. And this man is a physicist who is full-time now, who is doing the work of commissioning and whatever. I'm not but I know he's there and he's doing the job. So when the center is completely done, it will be look like this, and I think it will be a nice one. It is in Kigali. It is in the capital city, in the Rwanda Military Hospital, which is one of our big referral hospitals. As I said, it is a public facility, and we hope that the majority of our population will be able to afford it. We don't know yet the mechanism, how the affordability will be, but we are sure that our population will afford.
So the policy says what?
The policy is still.
Cost sharing.
I think the government. So the PPP is like the private partner will bring the expertise, and of course we'll have some benefit.
I'm talking about this patient now. Just
the patient. I think the government will have to put aside some funds to support vulnerable patients, and then we have a couple of insurance, health insurance, which we have to, which I think will pay for their patients, and then the government will have to pay for vulnerable patients, because we have a nice socioeconomic categorization, so everyone knows his socioeconomic category. So if I am in category 1, so that means that I'm poor, and the government is subsidizing some of my medical expenses. So in the meantime, we had to find a way to help our patients who need the radiotherapy. And in the past, we used to refer our patient to Mulago. And in early 2016, the radiotherapy machine was broke down. And Partners in Health, which is the main partner in cancer, as I said, had to find another facility to refer eligible patients, because funds are limited and we have to prioritize to some patients. So a contract was signed with the Nairobi hospital. So we went to visit Nairobi, all the centers, and to find out which one can give us the best offer. Because as you know, these private hospitals can be very expensive. So we were able to find a fair contract with Nairobi, and we had to hire a nurse who speaks Kinyarwanda, English, and Kiswahili, so that she can be an intermediate between the service provider and our patient. And this system is working very nicely. So for the past 2 years, 165 patients were referred, and it is not an easy job to determine who is going and who is not going, because we keep a waiting list. So, and with the help from our expert, we have elaborated a prioritization guideline. So we know who is priority number 1, depending on the diagnosis, the performance status, and the age. We will see the guide after. And we only send patients with the curative intent. We don't send patients on palliation. And the cost per cervical cancer patient is almost 5,000. This includes airfare and accommodation. So we fly our patients. We don't let them to take the buses, because if you had someone take a 26 hours bus to Nairobi with a tumor and whatever, it is not nice. So these are this is our guideline. So as you can see, cervical cancer patients, stage 1 to 3A, less than 60, they are priority number 1. But to be more specific, some patients with earlier stages, if they can be operated, we send them to a gyne who can then do a hysterectomy, and then that's it. So we end up sending 2Bs and 3As, and some earlier stages who are inoperable. Head and neck take the second priority, and as we go down, we have up to 12. So, and with this guide, after 2 years, we did a retrospective chart review to assess the implementation process and see how our patients were doing after those 2 years. So we looked at all patients who were sent to Nairobi for radiotherapy and have been follow up for at least 6 months to have an idea of outcome, so early outcome. So patients with incomplete documentation were excluded, and finally 84 patients were eligible for analysis. Of course, the majority of our patients are females because of the cervical cancer, and they come from all over the country. Unfortunately, only Rwandans are eligible for those referrals. For other services, everyone is eligible, but for radiotherapy, it's only Rwandans. And 67% are patients with the cervical cancer, followed by head and neck. Uh, 70% of our patients have completed treatment as planned, and there was one patient who, for whom treatment was suspended because he was found to be very sick and actually had brain mets, and they decided to suspend the treatment. And 28% of our patients experienced adverse event on treatment. At discharge, the majority of our patients were classified as complete response, and a few of them had partial response. As you can see, over 70% of our patients returned to Butaro for follow-up, have at least a visit, came back. So, thank you. And this is an outcome after 6 and 12 months. Over 66% of our patients were reported to be still alive after 6 months. And as you can see, the loss to follow-up rate was very high, 21 and 23%. So we don't know what is happening to these patients. So loss to follow-up is really a challenge among our patients. And it is not only the radiotherapy patient, I think it is for other patients in general. The median time until death or relapse was 10 months and 7. So as a conclusion, the Cancer Center has demonstrated that quality cancer care can be delivered effectively in a resource-limited setting by leveraging innovative partnership. Loss to follow-up among radiotherapy patients was very high, and we are looking forward to this radiotherapy unit, which we think will improve patient outcome and will increase access. I thank you so much, and this is my contact in case anyone needs to learn more about Rwanda. Thank you so much.